This video is one of a 4-part series for healthcare providers working at Indian Health Service, tribally run, and urban Indian healthcare facilities. The series shares the most up-to-date recommendations for preventing respiratory illnesses in adults through vaccination against COVID-19, influenza, respiratory syncytial virus, and pneumococcal disease. In this video, we'll focus on invasive pneumococcal infections and the role vaccination can play. Specifically, we'll discuss the magnitude of invasive pneumococcal disease, the populations at higher risk for serious illness, current vaccine recommendations, the safety and efficacy of the 3 FDA-approved pneumococcal vaccines, and strategies for increasing vaccine acceptance. Invasive pneumococcal disease, or IPD, includes infection with Streptococcus pneumoniae in a normally sterile site such as lungs, blood, or meninges. In 2021, in the U.S., IPD infections topped 17,000 and together caused 2,900 deaths. When considering who is at risk for severe illness, the vast majority of deaths, 98%, occurred in adults 18 and older. However, the highest case rates and mortality rates were seen in those who were 75 years and older. Pneumococcal vaccination recommendations for adults have varied over the past decade. The good news is that no new changes have been made to the recommendations since 2022. Currently, there are 3 FDA-approved vaccines for pneumococcus for use in adults: the pneumococcal polysaccharide vaccine, or PPSV23, and 2 pneumococcal conjugate vaccines, PCV15 and PCV20. This table summarizes the current pneumococcal vaccine recommendations. As you can see, no pneumococcal vaccine is recommended for adults 19 to 64 years old who do not have any underlying medical conditions. However, for people with underlying conditions in this age group, 1 dose of PCV20 or 1 dose of PCV15 followed by 1 dose of PPSV23 at least 1 year later is recommended. The same sequence is also recommended for those 65 years and older, whether or not they have underlying conditions. Note that based on past recommendations, some patients with chronic underlying conditions may have received more than 1 dose of PPSV23. Under current guidelines, this is no longer recommended. For patients who may have received PPSV23 or an earlier pneumococcal conjugate vaccine, further vaccination depends on which vaccination they received and when. This table lists the underlying conditions that place people at higher risk of serious pneumococcal infection. It is an extensive list and includes many common chronic adult illnesses that we often see in the patients we care for. Rather than memorize all of these conditions in many complex scenarios to account for prior vaccination, the CDC Pneumorex VacciAdvisor app can be a useful tool to determine whether pneumococcal vaccination is recommended for an individual patient. We've discussed current pneumococcal vaccine recommendations. What about vaccine safety? For many patients, vaccine safety is top of mind. Fortunately, you can reassure your patients that there is extensive evidence that pneumococcal vaccines are safe for most people. Common side effects for all pneumococcal vaccines are often mild and include fever, soreness where the shot was given, and fatigue. Let your patients know that most side effects will go away within a few days. Remind them that mild side effects are a good sign that their body is preparing to be able to recognize and fight the disease. You can also explain that side effects are not a sign of illness and that vaccines do not make you sick with the disease you are getting vaccinated against. Further, randomized controlled trials reported low numbers of serious adverse events, only around 2.5%, and that none of these events were determined to be related to the vaccine itself. In addition to sharing that pneumococcal vaccines have a good track record when it comes to safety, you can offer reassurance to patients by discussing how effective these vaccines are. For PPSV23, meta-analyses have found vaccine effectiveness, or VE, ranging from 45% to 60% against IPD. This means that patients who receive 1 dose of PPSV23 are 45% to 60% less likely to develop IPD. To provide better protection against IPD, current recommendations include PCV15 in series with PPSV23 or PCV20 alone. Although VE data have not been published for the 2 newest pneumococcal vaccines, PCV15 or PCV20, in clinical trials they were found to provide a robust immune response. Improving vaccine acceptance relies heavily on quality, culturally resonant materials and messaging. Consider accessing VacciNative's educational resources, which include colorful handouts, insightful videos, newsletter article templates, an educational flip chart, presentations for community outreach, and eye-catching social media posts. VacciNative's materials are designed to help you engage with your community and talk to your patients about vaccines. To access VacciNative materials, visit IndianCountryEcho.org/VacciNative. If you would like to know more, or if you have a question, check out the Indian Country Echo website, IndianCountryEcho.org. Here you can ask a clinical question, and then Indian Country Echo's clinical team will answer your questions and provide consultation. They will respond within 6 hours during the business day. Remember, every vaccine you give saves lives.